Hello, my name is MarkAlain Déry. I'm an infectious diseases physician and epidemiologist here in New Orleans, Louisiana. Despite significant progress in HIV prevention and treatment, disparities persist across different populations. This roundtable that we are going to have today brings together three distinguished HIV experts and stakeholders to examine the complex factors driving these inequities and explore strategies to promote health equity. By fostering open dialogue and collaboration, we aim to identify actionable steps to address HIV disparities and ensure access to quality care for all affected communities. The insights and perspectives that our experts will provide here today will be invaluable in shaping a more just and inclusive response to the HIV epidemic. And with that, let me please introduce our three panelists today. First up will be Dr. Monica Gandhi. She's an infectious diseases physician and professor of medicine and associate chief in the Division of HIV, Infectious Diseases, and Global Medicine at the UCSF School of Medicine. Dr. Sneha Jacob is an associate professor of medicine at Rutgers University, Robert Wood Johnson Medical School, as well as an HIV specialist with a background in internal medicine. And Dr. Hamadullah Shaik is an assistant professor in infectious diseases at Rutgers University, Robert Wood Johnson Medical School, and is associate chair for infection prevention at Robert Wood Johnson. Please, let's give our panelists a warm welcome. But I would love to hear how we each do diagnosis. So I'm going to just start first, and then we'll hand it over to Dr. Gandhi to still follow the same path that we've been doing. So usually somebody will come in, they usually have a diagnosis. It's rare, but not uncommon for me to be the first person to tell them they have HIV, but they've just found out, right? Because as I mentioned, we do same day start. Oftentimes as a primary care provider. And so the first thing I usually do is right off the bat, I know the first thing people are concerned about is life expectancy. And I show them the data. That life expectancy, I say, for me, it's close enough. So I'm going to say it's equal or almost equal to somebody who's not living with HIV. But more importantly, the quality of life is just the same as somebody who doesn't have HIV. And one thing that I have found is that people are fundamentally good. I know right now that we live in a very divided society, but people are fundamentally good. And that gives me hope. And the next thing people are concerned about is, oh my goodness, I just got this and I feel this feeling. I don't want to give this to anybody else. That's something that I have found almost 100% on each one of my patients. So the next thing I do, and I hand them the most important tool that we have, which is U equals U. And when they hear that undetectable is untransmittable, that is so powerful. In my free time, because I do have free time, I'm joking, I don't, I actually make cartoons. And so one of my animations is right here where I show U equals U, and I'm happy to share these with you. These were all done using HRSA funds. I started making these during COVID, but I show them the U equals U. I have one on PrEP and I have one on NPEP as well, but I show them this U equals U animation. It's a very professionally made, excellent animation using a person of trans experience who's the hero who teaches me and my colleague about HIV. So showing them and teaching somebody about U equals U is so incredibly important. And because we are so committed to same day start, I give them a sample of their first medication. I watch them take it, and then I take the cup and I drink after them. And that is, boom, that ends it right there. I can move to the moon and my patients will follow me there because of that one maneuver. And I ask them, why do you think I just did this? Why did I just drink after you? And they will say to me, because most of them will recognize that when you get home tonight and you tell your family, if you do tell your family or whoever it is that you have HIV, they're going to start hiding the cutlery. They're going to start hiding the dishes. They're going to treat you different. And if you tell them that your HIV doctor drank and shared the same cup with you, that they should not be fearful. And I find that that has been incredibly effective in my being able to give diagnoses. So I'm going to hand the microphone over to Dr. Gandhi.
I just think you just provided an amazing example of patient-centered care and something that I really have not heard of. And it's just an example that like HIV providers are the best. So I will say, you know, I say the same thing. It's all, I mean, and this is so different than when we were treating earlier on. And obviously, I think Dr. Jacob's too young, but like, I think we, that used to like have to tell people that these meds are going to be difficult. I mean, and now you can say the following, and I say these following. You're going to have a normal lifespan. You are going to be just fine. Your life is going to change so that you take one pill once a day, and that's it. That's the only thing that's going to change. You may even get it on an injectable that is once every 2 months, and then you don't have to think of it in between. If you have side effects on your medication, we can change it because it's my fault if you have side effects. That just means to me that we have so many options here, and you don't have to have any side effects. And my goal is for you to think in 6 months about whether you got milk or not, and not think about your HIV at all. And I also use U equals U a lot. That has been so powerful to have that as a destigmatizing way to say that take your medication and you don't have to think about it, and you're not going to pass it on. So it's so amazing to treat HIV in this day and age that we can say all that. And we also do rapid ART. So I can say to them, when you tell whoever you're going to tell tonight, you're going to tell them that you got a diagnosis, but that you got on the medication to absolutely fix that diagnosis.